We will talk about COVID-19's new subvariants, which are called HV1 and JN1. First, we had original virus. It was COVID-19's original virus, and it mutated over time, and we got Omicron. And over time, Omicron also mutated. It changed the spikes. These are spikes, small proteins, and we get new variant, new subvariant. We had two important subvariants. They are HV1 and JN1. We also have other subvariants, but they are less important currently, and we will explain why it happens and why HV1 is important and JN1 is important. Because they spreading rapidly compared to other subtypes, and they have ability to evade the immune system. It's very important. So they have two main characteristics. They are not very severe. They are milder form compared to older strains of COVID-19, but they spreading rapidly. That's most important. They have high transmissibility, and they evade immune system. And these new subvariants HV1 and JN1 occurs in people also who are vaccinated. So we have vaccine works, vaccine is effective, but even vaccine is effective, these two subvariants is common in vaccinated people because they have ability to evade this immune system, and antibodies which are already exist in the body in people who are already vaccinated can't catch the virus because their spikes are changed. Their spikes are mutated. That's why they are common in people who already are vaccinated or who already had COVID-19 previously. Of course, if we compare how fast they are spreading in people who are already vaccinated or who never vaccinated, of course, spreading in people who are vaccinated is low compared to people who never vaccinated. That's true, that vaccine still works, but these strains, these subvariants, still affect people who are vaccinated. Another important question is if symptoms different from other COVID-19 variants. Symptoms is not importantly different. It looks like classical Omicron variant, and first symptom usually is runny nose, and runny nose is important symptom. Sometimes people think that it's just allergy. Headache is common symptom, sore throat is common symptom, cough and weakness and body pain is common. In more severe cases, fever, chills and shortness of breath also occurs, but usually it starts with runny nose and it's classical presentation of Omicron. It's not different from Omicron. It's not more severe compared to Omicron also. And here is also important question about hospitalization and death rate of these new strains. Hospitalization of HV1 and JN1 is same compared to other variants of Omicron. It's much milder compared to original form of COVID-19. For example, death rate in case of these new Omicron variants, subvariants, is around 0.5% is death rate. It means that if it's affect 200 person, one person will die because of this COVID-19. But originally, death rate was around 3%. It means if one person will die from 200 affected, here 6 persons would die from 200 affected. So these new versions of COVID-19 are much more mild, but still can cause death, especially in risk groups. And now let's ask a question about vaccination effectiveness, vaccination efficacy, because people say that if this new Omicron variant still affect people who already vaccinated, why should I vaccinate? But we still need vaccine, and why? In people who got 2 shots, 2 doses of Pfizer and Moderna vaccines, have around 60% protection from symptomatic COVID-19, even from this new variant. So they have 60% protection. It's still good. From 0 to 60, it's still important progress. And if they got booster dose, booster shot, then protection is up to 80%. So 80% of people who are vaccinated 3 times, 2 original dose and 1 booster dose, they are protected 80% from developing symptoms at all. And they are protected around 95% from death and hospitalization from the virus. So we still have very important effectiveness of vaccination because we have over 95% protection from death from this virus. And yes, person will say that yes, it's true, but for example, I have still low chance from dying from Omicron. Yes, it's true. It's true if you are young and if you are healthy, you have very low chance that you will die from Omicron. But person who are old, over 60, person who has diabetes, heart disease, kidney disease, respiratory symptoms disease, who have chronic disease, who are immunocompromised, they have much higher, several folds higher risk of death from these new variants of Omicron HV1 and JN1. So we should be careful and vaccination is recommended. World Health Organization recommends universal vaccination for all age groups, but priorities are people with chronic disease and people with over 60s and health workers and people with respiratory disease and chronic illnesses. And now about treatment. Usually treatment is symptomatic if disease is mild. If person has risk factors such as chronic diseases, then Paxlovid is treatment as soon as symptoms appear. It's antiviral medication which decreases progression of disease and severity of disease, hospitalization and risk of death. So we have some treatment, but usually it's still symptomatic treatment. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.